Welcome everyone to a people's response to community safety, public safety as public health. First, thank you so much to our People's Response Act Day hosts and organizers. Thank you to Congresswoman Cori Bush, her staff, and the steering committee for our coalition, Movement for Black Lives Matter Foundation, SC Justice Group, Civil Rights Corps, and Color of Change. I especially want to thank Thea Sebastian and Sam Washington for co-conspiring with me on this panel, as well as to Lorelei and Jack for interpretation services today. So we are here today to talk about why we need to collectively reimagine public safety through a public health lens. Part of that work, though not all, is needing to pass the People's Response Act. Today, we'll reflect on how BIPOC communities are routinely marginalized along multiple social determinants of health axes and how that harms individual, family, and community health. We'll talk specifically about the rise in mental health crises, especially since the onset of the pandemic. And finally, we'll discuss the consequences of continuing to view public safety through a punitive and carceral lens. So for those I haven't had the pleasure to meet yet, my name is Amber Akemi Pyatt. I am the director of the Health Instead of Punishment program at Human Impact Partners, or HIP. HIP is a national public health organization. We are headquartered in Oakland, California on Ohlone land, though we have remote staff across the country. And our mission is to transform the field of public health to center equity and to build collective power with social justice movements. At HIP, I lead our Health Instead of Punishment program, which seeks to advance racial justice, community safety, and health equity in partnership with those who have been most harmed by today's immigration and criminal legal systems. So what does that mean and why does it matter? Public health research is really clear. Policing, incarceration, and state surveillance measurably harm our health. If you want to dig into that research, I would advise you read the American Public Health Association, or APHA's, policy statements on police violence and carceral harm, which really clearly lay out both the problems as well as evidence-based abolitionist solutions. And I want to say, I do not want to be particularly formalistic about what is and is not public health research. I don't want to relegate knowledge creation to researchers with fancy degrees. Directly impacted people sharing their truths in whatever time, place, and space they find appropriate is valuable and valid data too. So the stories we read online, the experiences of family members, for example, of those who have been murdered by police, the chorus of chants to address racism and policing as public health crises are all part of the public health evidence we're talking about here today too. So taken together from the ivory tower to the streets, we're in a moment in history where the demand for public health approaches to community safety is now clearer and more widespread and more undeniable than ever. So that's what we're here to unpack today. I'm really excited to be joined by an exciting group of speakers. We will have opening remarks from Civil Rights Corps, from our partner Alec, who will ground us in what the People's Response Act actually does. And then we have a powerhouse panel of folks who all work in health sectors themselves to talk about why we need non-carceral, non-punitive safety infrastructure. So without further ado, I'm gonna invite Alec to come into the spotlight as well. Thank you so much, Anna, for running the tech on this, to tell us a bit more about what this bill is actually all about.
Thank you so much, Amber. Hi, everyone. Wonderful to be here. Before we talk a little bit about the People's Response Act, I think it's absolutely vital that we set a little bit of the broader context. We're having this conversation in the midst of a society that is caging human beings at rates that are unprecedented in the modern recorded history of the world. We're caging human beings at rates 5 times our own steady historical average up until about 1970. We're caging human beings at 5 to 10 times the rate of other comparable countries around the world. And it's not just human caging, it's all of the other components of this large punishment bureaucracy that devastates and destroys people's lives, particularly the lives of very poor people in our society, and particularly the lives of communities of color. We're talking about separating children from their families. We're talking about people unable to meet the basic necessities of life, including food, shelter, clothing, and other things that they need to survive because of the ways in which the criminal punishment bureaucracy surveils and controls and extracts from them and their communities. This is absolutely devastating. And it's not a random distribution of people from our society. They're very particular groups that are constantly, year after year, targeted by these large, excessive, wasteful, criminal punishment bureaucracies. So I think what we're talking about when we talk about this criminal punishment bureaucracy is really a set of social policy choices that our society has made to invest in certain types of bureaucracy. So take, for example, the war on drugs. The war on drugs is a multifaceted set of interlocking policies and assumptions and beliefs about a certain type of human behavior, drug use. It has led to the arrest and human caging of tens of millions of people over the last 40 years. It has led to the separation of tens of millions of children from their loved ones. It has led to human caging for hundreds of millions of years. It has led to police raids that have killed tens of thousands of human beings, disproportionately Black people and other people of color. It has led to firebombing and chemical spraying across Latin America. It has led to permanent cancer-causing carcinogens throughout the drinking supply in areas of Latin America. It has led to surveillance on a scope previously unimaginable of global communications. All of this was created through massive public investment in bureaucracies of control, all purportedly to address a public health issue of the use of certain substances. And so whether it's the drug issue or whether we're talking about other forms of mental illness, other forms of inequality and poverty, all of these are problems that could be conceptualized through public health investment, but instead, because of the way in which investments in carceral bureaucracies actually increase the profit and control of certain elements of the ruling class in our society, instead we've made these investments in forms of social control. So the People's Response Act is actually an attempt to intervene in this 4 to 5 decade long massive investment in human caging and carceral control to solve social problems. And this People's Response Act, which grew out of the incredible work of BLM, Movement for Black Lives, and really the visionary Breathe Act that those groups helped develop in conjunction with public health experts and other experts across the country. It's an attempt to shift the kinds of investments our society makes toward communities that can actually flourish. And it's really an attempt to ask the question, what kinds of investments in our children, in our communities, do we need to thrive? What kinds of more holistic investments to advance the concept of true safety, to prevent violence, to mitigate harm, and to ensure that all people have what they need to flourish? So this People's Response Act asks questions like, what does safety look like? Well, safety looks like children walking to school without worrying about a stray bullet, like people having clean air to breathe and safe water to drink, like families having stable, affordable housing, like neighborhoods flourishing without the collective trauma of police violence, like theater and music and poetry and art programs and athletic programs for people to participate in and build community and relationship with. It looks like mutual aid. It looks like intervening in the problems that cause harm and trauma and violence and interpersonal conflict before it occurs, not merely responding afterward on the back end. It looks like creating the infrastructure through policy change, using and leveraging the kinds of brilliant ideas that directly impacted communities have been coming up with themselves and implementing themselves on a small scale all throughout the entire era of mass incarceration, but that our general public policy and government haven't invested in. So we're talking specifically about targeted non-carceral interventions, things like violence interruption programs, things like non-police first responders, things like healthcare, financial assistance, housing, high quality education, and extracurricular activities for children. The research is overwhelming. There's a scientific consensus that these non-carceral, non-punitive interventions are effective in reducing what the police call crime, in preventing violence, and in improving all of the other kinds of harms that aren't dealt with in the criminal punishment bureaucracy, but that are impacting people's abilities to thrive with their families. And so what the People's Response Act does is it creates a new federal funding mechanism through the Department of Health and Human Services to actually invest in community-based organizations who are working with directly impacted people and people most affected by all of the forms of inequality throughout our society to develop the programs that work in their community. So what's so exciting about the People's Response Act is for the first time, it really is shifting a massive form of public investment towards solving some of these problems away from carceral bureaucracies into the creation of new community-based concepts of care.
Thank you so much, Alec. Thank you. Thank you so much. I want to pull out three things from what Alex said as we transition into hearing from our wonderful panelists. One is this emphasis on prevention, right? So when you think about taking a public health approach, so much of what we're talking about is preventing illness, preventing injury, preventing harm. And these are exactly the sorts of things that the People's Response Act would fund. So that's one thing. A second thing I want to pull out is this piece about budgets and investments being choices. You know, I think about the quote that is attributed to Martin Luther King Jr. around budgets being moral documents. How we invest our collective resources is actually a reflection onto what we care about, and what we need is more investments and a commitment to caring more about non-carceral, non-punitive safety mechanisms, particularly that address the ways that our current criminal legal system perpetuates anti-Blackness and anti-Black racism, right? So we are making choices about how we invest our dollars, and it's time for our electeds to choose differently. And then finally, this piece around the amazing local grassroots interventions that already exist, the mutual aid networks that already exist, and exciting programs like Mental Health First, which we will be talking about here today. So with that being said, I want to introduce our wonderful panelists. First, we have, and I might not go in this order, but one of our speakers will be Karis Jan Myrick, who is the co-director of the Mental Health Strategic Impact Initiative. She serves on the board of the National Association of Peer Specialists and is the podcast host for Unapologetically Black Unicorns. Ms. Myrick has over 15 years of experience in mental health services innovations, transformation, peer workforce development, and has authored peer-reviewed articles and book chapters. Finally, she's held executive positions at the local, federal, and national levels, and was on the board, was the board president for NAMI. We also have with us Asantewa Boykin today, who is the co-founder of APTP, or Anti-Police Terror Project, which is an organization committed to the eradication of police terror in all of its forms. She is the program director for Mental Health First, which is a mobile mental health crisis response team aimed at minimizing police contact with those who are in the midst of a mental health crisis. And finally, we have Courtney Andrews, who was born and raised in the American South and currently works full-time as a health scientist at the Centers of Disease Control and Prevention, or the CDC, in the Office of Minority Health and Health Equity. She's previously been involved with organizations like Southerners on New Ground, or SONG, and Black Youth Project, or B100, or BYP 100. We love our acronyms. She's interned with the World Health Organization, or WHO, and is an alumnus of the inaugural Black Futures Labs Public Policy Institute. So I hope you all are as excited as I am. And maybe first, I'll start with you, Courtney. Like I just mentioned, you work in a federal health agency, and you've also built power with grassroots organizing groups like SONG and BYP 100. So I'm curious if you could just start by telling us a little bit more about your work and how you think about this relationship between resourcing non-carceral safety infrastructure, including through the People's Response Act, and sort of broader anti-racist movement work.
Yeah, and thank you for the opportunity to be here. I appreciate being here with all the other panelists who have amazing backgrounds and doing amazing work. And I will first say that like I don't speak for HHS or CDC, even though I'm in a federal position. So I do want to put the caveat out there. But when it comes to legislation and any policies, particularly from whether we're talking about a local public policy or even talking globally in terms of a lot of the work that movement folks, formerly incarcerated folks, queer folks, everybody's just moving together during this really interesting and very trying time right now. In terms of the question, I always kind of think through in terms of the landscape of thinking through policy and practices as a beginning start point. I know sometimes people see legislation as the end all be all, like, okay, we got a bill or we got something signed. But when it comes to my systems thinking and, moving with my comrades and organizing spaces, it's really using those levers and those practices and those, threads, those blueprints as a means to be able to not only open the door, but also reimagine things as the bill is talking through as those others and the other panels will very eloquently speak to more than likely to create, new programs, new services, new initiatives, or just new paradigms of how we can take care of each other when it comes to healing justice, restorative justice, or just, abolitionist politic. I think for me, my organizing experience when it comes to working with groups in all sectors and all over the world, it's really thinking through how we can, have participatory budgets, have more folks be at the table and centering those who are most impacted, which is really critical and key to a lot of this work, because I think it's often been a top-down process of people who don't have the lived experiences saying like, we need this, when it's a complete opposite of what folks have been saying since the beginning of time, particularly those coming from oppressed backgrounds or at multiple intersections, thinking of, Black feminist study in politics in particular. So I think from the work, especially for where it is right now, especially in the grassroots arena and internationally, it's really thinking through the ways in which, again, policy can be that starting point. It can be a way to codify and have accountability. It can be a way to reconcile, like, this is what's gone on historically. This is a way to move the lever. But it also, really puts the hammer on folks to say, like, how are we going to center communities, folks who've been doing the work and things that we haven't done and been allowed to do, and really just open the space to be creative and thoughtful and to build on the legacy that folks have been talking about since the beginning of time. So I hope that answers the question, but that's kind of to me how I see it, especially during this time where the blueprint's out there. We just need to start moving on it. So.
Totally. Thank you. I really appreciated this piece that you were naming, Courtney, around, policy as a tool. It's neither the beginning nor the end of this sort of broader work, and how important it is to stay grounded in the realities of those who are living through the issues we're trying to address, and centering those experiences and stories and those people inside of policymaking processes in particular, because if we're trying to address an issue, the folks who are impacted by those issues are going to be the ones who live with the proposed and implemented solutions as well. And it just makes me think, Karis, you speak so powerfully about the relationship between your own lived experience, your work with big and powerful institutions like NAMI and the National Association of Peer Supporters, and the need for federal investments into our communities and the ways that all of those things and sort of spaces talk to each other and experiences. So maybe I wonder, we talked earlier and you mentioned you feel comfortable sharing a bit about your own lived experience and how that informs your relationship to the work. And I would just invite you to share what you feel comfortable sharing here in this space.
Okay, sure. So thank you very much. And I want to make sure also to give a visual description of myself for people who may have vision loss. I'm African-American, I'm Muskogee Indian, so I have long black hair, purple undercut, a little bit of gray coming in, black glasses, and I'm wearing a black sweater that has white on it and a button that says good trouble, necessary trouble. Thank you, John Lewis. So I'll go ahead and start. So one of the things that I always try to encourage people to do, especially people of color, is thinking about what do we know about mental health? How do we talk about mental health? And how do we break a lot of the stigma? So that's why I have been very open about my personal lived experience story. As more attention has been paid, especially in the past few years, around crisis and crisis response and police response and moving away from carceral systems, I think it becomes even more critical for us to be able to share what our experiences are, so that the work that is being done isn't done out of context, and it isn't done out of some sort of, well, oh, we had no idea that's what it was really like. So we want to make sure that people have an understanding of what the experience is like, and that we're at the table to shape the reforms into things that will be helpful, especially for Black and Brown folks. So, I am a person who was given a diagnosis of schizophrenia, which was really tough for all of us in the family to wrap our heads around what did that really mean. For me initially, and I did not tell my parents initially, there were low expectations set. There was a lot of fear set. We're looking at, media portrayals of people with schizophrenia or psychosis or delusions as people who are dirty, not scary, all that kind of stuff. So I thought I was that person, and the system actually treated me like I was that person. So it was really tough. But one of the things that happened when I was really struggling was that I actually did call my psychiatrist for some help. I was really struggling. And the protocol is, if you're a danger to yourself or others, which at the time I was feeling not safe for myself, to call 911. And when he told me that that would happen, in my mind, I thought, oh, it's a health thing. I'm being told mental health is like any other health condition. So in my mind, I'm thinking you call 911 and an ambulance comes or EMT comes. That's what I thought would happen. And that is not what happened. Basically, what happened was police came to my very small apartment building where I lived. I at the time was the only African-American living in that particular small building. So the police came in a police car in their full uniforms. They came to my door and knocked very loudly at the door, really loudly. It's not just knock, knock, but like they were banging at the door, and they were screaming, wellness check. And I'm thinking, oh, whoa, wait, what's going on here? And the first thing I wanted to do was get them out of the hallway, because I was worried that my neighbors would not understand what was going on, would then kind of go to that stereotypical, well, what did she do kind of thing. And so I just wanted them out of the hallway. And it was very, very traumatic. Basically, I was handcuffed. I was put in the back of a police car. And this is how I was told people with mental health conditions that, make claims about wanting to harm themselves, go to get help. And I'm trying to understand, how is that you go to get help? This feels like I'm criminalized. I don't understand what's going on. And it's making less and less sense to me about mental health is like health, because that is not how you would take somebody with diabetes. That is not how you would take somebody with asthma. That is not how you would take somebody, with Alzheimer's. It's just not how it would happen. I was ultimately taken to the police station, and worse yet, I was handcuffed to a chair while they interrogated somebody else who was there until they could actually transport me again by handcuff to the hospital. This is not a one-off sort of anecdotal story. This can happen very commonly to people. And in fact, a few years, I don't remember, it was a few years later, a few years before, Miss Mitrice Richardson in the same area where I live was having some issues as well. She had a diagnosis of bipolar disorder. The people in the restaurant called the police to come and take her, come and check on her, do a welfare check. They came, they took her to the police station, and she was never heard from again up in the Lost Hills area, Malibu area of LA. And ultimately, they did find her body not too far away. Now, let's be clear, when the police took her, they knew she had a diagnosis of bipolar disorder because they called her mother. When they released her without a wallet, without a phone, without any ID, and without any way to get up. And this area is not, I don't want to say it's rural, but it's not like she could just walk to the next house over and knock on the door. It is a very sparsely kind of populated area. So in other words, I mean, just to make a long story short, the response is not one that is rooted in health. It's rooted in danger. It's one that causes trauma and re-traumatizes folks, so much so that we don't want to be involved in the mental health system. And then we get blamed. Well, you're not being compliant, you know, that sort of thing, when in fact, it's like, well, maybe the compliance and the need is someplace else by removing what has to do with carceral systems and crime out of mental health. I do want to be clear too that sometimes for us, hearing about community safety means that the community is trying to keep itself safe from people who've been given diagnosis of serious mental health conditions, versus thinking that we're part of the community, and guess what? We want to be safe in the community as well. So for me, community safety is about all of us being safe, all of us having maximal health, and all of us having giving voice and participating in solutions that can be driven at the community level for when, where, and how we need it, so that we have a place to go, a place to work, a place to have fun, and that our lives really do matter.
Thank you so much for sharing that, Karis, and I'm so sorry that you went through what you went through. I think this is kind of a perfect segue to the work that you're doing, Asantawa, and with Mental Health First and as an ER nurse. And so I wonder if just you could share a bit more about Mental Health First, why it was started, how it works today, what potential and need you see for the model going forward, especially sort of perhaps especially being grounded in the experience that Karis just shared with us, and how your relationship and your background to your work as an ER nurse sort of informs your work with Mental Health First as well.
Absolutely. I'm sorry, Karis, you had that experience. And I'd also just like to show some gratitude to the space, to the folks at People Response Act, and my fellow panelists. I'm extremely honored to be speaking to y'all in this, specifically in this space. I would first like to start by talking about Mental Health First, right? So it's a non-police, non-911, and I make that distinction intentionally because we cannot be contacted via 911, right? So we have an organic number. Folks can reach us by phone, DM, email, whatever platform the community has access to. We will use that mechanism in order to communicate. MH First is a program of the Anti-Police Terror Project, which is a coalition of organizations, individuals, multi-ethnic, multi-generational. And the thing that we do have in common is our dedication to eradicating police terror in all of its forms. And we've done that in a few ways, by creating replicable and sustainable models of alternatives, for instance, like MH First. So during our time doing work with families, right, who had experienced police terrorism and needed like long-term support, right, we really began to bump up against like this mental health thing, like supporting those folks, right, as they deal with the crisis that they've already had. And then also, because we were an organization that were saying like, don't call the police, let's try something else, right? Just by consequence, folks started calling us. So we found ourselves in a position to where we were just responding to these things organically, right? So then we began to ask ourselves, why can't we create this kind of thing that would be available to the larger community? And the answer to that question was yes. So then we had to kind of go back and really understand where we wanted to intercede, right? And we come to understand that 1 out of every 4 people that are murdered by police were in the midst of a mental health crisis are dealing with substance use issues. So it made absolute sense for that to be the intersection for us to minimize police contact. If the police can't terrorize you if you don't come in contact with them, right? So that is the goal primarily of Mental Health First. We chose to operate during times where there were the least amount of crisis services available, and that happens to be after hours and on the weekend. I still cannot wrap my brain around why crisis support is like scheduled during business hours only. I'm only speaking for what I understand to be in existence in Sacramento County and in Alameda County, but I imagine that paradigm exists across the country. So we started here in 2020. And I always like to give a shout out for anyone who did anything other than survive in 2020, because it was definitely created even more of a challenge, right? Because of COVID. And because of COVID, we had kind of went to crisis response hotline because we didn't want to put our volunteers in danger, and we are run 100% by volunteer labor. But that too has been super successful. We found that a large bulk of our calls are just folks who don't know how to gain access to the mental health services that they need. And then folks who have just cares. When I think of your story, like the way that we treat folks teaches them to lie to us. It also teaches them that this is not where you get help, right? We had a young man who absolutely knew that he needed to be in a hospital, and he called us because, in quote, he did not want the police to F him up, right? And he said he was not in the mood, and we know what that means, to be disrespected by EMS. So he called us, and we had a clear, no common sense solution. We got him a lift to the hospital. Easy peasy, right? And we could have saved his life for all we know, right? And for us at APTP, shifting to that space of like, we don't know if we saved his life, to from, right, like marching and rallying because someone has already passed or someone has already been murdered. So that is what MH First is. And my experience as a ER nurse, I find that our emergency rooms is like the catch-all for all of our public health crises, bumping into each other, from mental health to being unhoused, to the lack of investment into teaching folks how to use our healthcare system. You'd be amazed at how many folks don't know how our healthcare system works. And it also has taught me that sometimes the most common sense solution is the one that works, right? Especially inside of these healthcare systems, there's so much bureaucracy. Check this box and then this box. And then if you don't do this box, right? When it's just like, you need food, let me give you food, right? So I hope that answers the question.
It does. And, it's like, there's no amount of thanks I could give to you and APTP and MH First for building what you've built. But as a resident of Oakland, I can't tell you how many times I've been able to refer people to MH First. And, my background before getting into public health was in mental health. And I have a loved one who's been hospitalized involuntarily multiple times for their mental health. And so there's kind of a way that as a primary support person for that person, and given my more professionalized background, I end up being someone people call when their neighbor's in mental health crisis or whatever, and being able to refer folks to a team of people who have been trained is so important. And I just want to connect a dot here to the People's Response Act, which is that one of the things that the People's Response Act, if passed, that it would do is create these grant programs so that we can fund local government, state government, and community-based organizations to be building these non-safety infrastructure programs and services. And you just think about, like, the actual first responders are your neighbors. They're your coworkers, are the people in the building with you. That is who actually responds to crisis with you first. So it's so crucial that we're training up and skilling up our people, because that's who you will turn to when there's an earthquake, when there's a fire, when there's a mental health crisis. And so I just want to lift up that Mental Health First is doing that by offering public trainings in Oakland to folks here. So thank you so much for that. Next, I kind of want to, pivot us a little bit, though we've kind of touched on this in various ways. We have various kinds of like professional expertise represented here on this panel, from nursing to public health and mental health. And some of our listeners here today might be health workers as well. And when I say health worker, I take a pretty broad and inclusive idea of that, so medicine and physicians and public health and nursing and mental health and peer support and global health and reproductive health and all kinds of other things, right? And I just wonder, you know, there is a commitment that some health workers make to do no harm. And if you understand policing and police to be fundamentally harmful, that makes you have to question what your relationship is there. And there are the realities of us being humans, working often inside of institutions, which are deeply embedded with perpetuating oppression, and inside of fields that are in some ways having reckonings with their legacies and ongoing realities of perpetuating structural racism and other forms of oppression. And so I kind of want to open up a conversation here about what that means for you and your practice, and sort of some maybe calls to action for decolonizing and bringing in a more anti-racist lens to our work as health professionals, and of course other folks who work in other sectors. I just want to open up a conversation there, and whoever wants to jump in first, please feel free to go for it.
I'd like to at least jump in to follow up and say that very rarely in the conversations that are happening within especially mental health or quote unquote behavioral health around crisis response, do we ever see Black and Brown folks talking about what they're doing at the community level, especially what a Mental Health First is doing. And I think that is, I mean, I do want to say it's refreshing, but more importantly, I want to say it's needed, because a lot of the models that are held up and then are moving forward to be emulated, which may be community-based models, are not models that are developed by us, if you will, developed by people of color within communities of color to meet the needs of communities of color. In other words, they may not be culturally relevant, they may not be linguistically relevant, and kind of folks are forgetting to think about that piece. It's like, well, we'll just pop it here, we'll take this model and we'll pop it here, without really thinking about what does that look like from a cultural and community lens. Secondarily, I think some of the other solutions around, and I like the term People Response Act, because it really aligns with how we think of Nothing About Us Without Us, that as we are creating these new systems, as we're creating, and again, maybe they're not systems, but as we're creating community-based responses, that the workforce will not look like the traditional workforce, that now we'll do what we're called like task sharing, which means my neighbor who now knows, don't call 911 when you're experiencing someone out front of our place who's homeless and you don't know what to do, so you dial 911. We can teach folks, have some socks, have some water, have some feminine hygiene products, have some raisins, things like that, so that you can create a relationship with this person who is our neighbor. They're not some random homeless person, they're our neighbor. And so I think, as we think about, well, who are the responders? And it becomes, as you say, it becomes all of us. And then for many folks, how do they get compensated so that they have a living wage? If you're a peer support specialist, if you're a community health worker, if you're a promotora or promotores, that you have a living wage. Asking people to do this work and then not paying them for the work makes it really, really difficult, I think, for us to have sustainability and to have quality workforce and to really address social determinants of health and poverty. We can't have our workers in poverty. We can't have our workers also struggling with homelessness while they're trying to support the emotional well-being of the community. And that's going to be really, really critical.
Thank you, Karis, for touching on so much of that. That's one of the challenges that we at Mental Health First have experienced, right? Because of our lack of resources, right? Like not being able to pay folks to do this work full time. It would be a great victory, right? For MH First to have equitably paid staff, primarily people of color, 100% impacted, and we are working diligently, right, to create that space. Things like the People's Response Act, things like the Crisis Act, which just recently passed, which gives funding to community-based organizations to create their own first responder systems, are going to help those things come to fruition. And we're really excited to just continue the work and to keep engaging with people. And one of the things around, so the young man that I spoke of before, it's just like those culturally competent things, right? When he said he was not in the mood to deal with EMS, as a person of color, I understand that that is not an emotional state, right? That is a psychological state of, I am at my wit's end, like not today, right? So having programs replicate like across the country that do not understand those subtle, right? Those subtle vernacular things that will give you an insight, right, into how someone is really feeling is not doing a service to the community at large.
No, I appreciate this conversation. And I apologize on the front end in a sense of visual description in that I am a Black person who has long Black hair and bangs and 70s looking glasses that are pink gold. And I'm wearing like pink lipstick and have a virtual background because of shenanigans with my placement. But to reiterate what folks have said, I mean, I think it's also unlearning this heroic individualism that's kind of embedded that doesn't really support community-based or healing practices that a lot of folks who come from like oppressed backgrounds, you know, innately have, but we are shamed and put into this kind of box of having to move and act a certain way that isn't really, to me, part of where we actually come from in terms of who we are as people. And what I mean by that is, I think, again, like the medical industrial complex and the carceral system act with both of each other to try to make people feel that they don't have the solutions that they can have to build power with people and build power with folks. I think as a public health practitioner, I mean, I think to me, the core of it is health justice, and that the ultimate goal that anybody in health does is to be able to build out these systems so that we can honestly be out of jobs. Like that's literally my ultimate goal in life. But it's also to, you know, have the lived experiences and tap into that and not say that I could speak for other people either, because I don't have a savior complex either. I think it's about trying to tell people to decolonize, and that what's going on here in the United States is also replicating and manifests differently all over the world. And being mindful of that, you know, people of color, disabled folks, queer folks have the solutions that we can build around, and that if you can redistribute your power and build with people, then ways that we can heal in terms of the generational harms and trauma and actually be able to intervene for loved ones would be a lot better off than kind of the individualism and the way in which our systems are structured right now that, you know, allow certain folks to be able to get the help they need and not have to do with anything, versus, as you've heard and are hearing, you know, a lot of people have to go through hoops, jump, and still deal with the trauma of even seeking help. And that's ridiculous, and it's hard to stomach, and it's exhausting. So I think the more that people can really think through of like how not to be a cop and not to assume you know how someone actually is, you know, functioning and how they are living their life, and knowing even with the intersections they live at, they probably are the best person to know what they need. And for us to like build infrastructures to do that, especially as a scientist, I love science fiction work. Imagining those worlds, I think, is really important. I know we can do it, but people have to be willing to give up some things for that, and also to fund the policies and practices and ways we can move to get to those steps. Because people are always like, well, we can't do it. I'm like, no, it's possible. People have been doing it for millennia, before we had modern medicine and stuff, before we had the things that you think we had. I mean, we had a whole pandemic too. So it's very evident that there are solutions, but the more we center the folks, again, who are the most impacted, and for those of us who have the social locus of control or power, to kind of take a step back and be like, I don't think I need to be in this space saying what I'm saying or doing what I'm doing, or maybe I need to see if I can fund this organization that's already doing something and build with them, versus trying to have 50 million things doing the same thing, if you get my drift in terms of that. I think we'd be a lot better off, because there will be other pandemics, there will be other things that happen to us as a species. And the more we're in harmony with science and technology and nature, and really learning a lot of the things that we as a human species know we're capable of, and unlearning some of the ways that we were taught, I think that we'll move in a better space. sooner than later, because I think we really need to do that before we get further indoctrinated in ways that are causing us all harm, honestly, at the end of the day. So.
You know, it's so interesting what you were just saying. First of all, Octavia Butler just like popped in my head. How did that happen? Thank you so much, right? She tried to warn us. But anyway, one of the things that I was thinking about is you're talking about unlearn. Sometimes we have to learn because sometimes we don't even know the genesis of where things start, like the deepness of it, especially around decolonizing. And I'll talk about mental health in particular, but health and mental health. And, you know, in our field, we, you know, everybody can talk about drapetomania. Everybody knows the word, everybody knows the genesis of this, you know, sort of pseudoscience now, but not then, diagnoses for enslaved Africans who run away. Well, that's a diagnosis, and you have this mental illness, and the diagnosis is drapetomania, which of course makes no sense in anybody's mind, except back then it made sense. But what it also led to was the setting up of a very interesting system of, well, we call it care, but it's not care, where people, enslaved Africans who had mental illnesses such as drapetomania, were kept in hot houses. They were kept in, you know, very closed quarters. And when I think of what does that look like today, we call that solitary confinement, and we call it seclusion and restraint. But it started all the way back at that time. And also there was a evolvement of other diagnoses such as rascality, which means laziness, that if an enslaved African was lazy, that the treatment, it had a diagnosis of, which I cannot pronounce, but it had this diagnosis of whipping the person and then treating them like a little child. And so I think again of our current system of one that has a punitive nature, even though it's supposed to be about care. One of the things that was sort of transported from Europe to the United States during colonization, and then set up especially to start with you know, enslaved Africans, was a system that was actually based on coercion. It was based on commitment, custodialization, compulsory detention. It sounds very familiar to today. So that affects all of us, even though it was grounded in how folks were treating enslaved Africans. It continued to be how we have our system set up today. Think about, you know, involuntary commitment, you know, those sorts of things that are legal mechanisms that really are on the basis of this colonized system. And that's what we need to decolonize as well. But we have to understand that history.
Thank you so. Oh, go for it, Asantua.
Okay. There was a couple thoughts that I had that I would just like to share. There is ways that we can decolonize our individual practices, right? Recognizing language, for instance, there in medicine period, a lot of the language mirrors, right? Military mirrors police and policing language. For instance, if someone doesn't want to, declines a medication, right? That's the language that I choose to use, right? But the language that the system uses are refuse, right? Or someone is being non-compliant, as if the expectation is for them to just do what we say as healthcare professionals, right? And then not getting the healthcare education, right, as we're going through these programming schools, right, about how to care for ourselves, and then also how to get access to these healthcare systems. And also there's something that is super practical that we all can do no matter what sector we're in to decolonize whatever field it is. And that is identifying policy and procedures that exist in wherever you are, right? And picking them apart, changing them, right? There is so many policies as a nurse that we bump up against that are just like, yo, this is targeting. This is strictly like those signs outside of the nightclubs that say no baseball caps, no t-shirts, no tennis shoes. You're like, oh, so no Black people, right? There are those same policies that exist inside of the healthcare system, and I imagine across sectors, but we can go to our directors, our managers, whomever, and begin to pick apart those policy and procedures that are either have an undertone of racism, classism, ableism, sexism, all the things, right? So practical things that we can do to shift entire industries.
Thank you so much for that. It's so important. This work can feel really big and kind of in some ways esoteric, and it's so great when we can sort of bring it down, like, yes, there are things, practical things we can all do every day. And we're not going to say it's easy, but it's important and it's pragmatic and it's the work. I want to connect a couple dots here, and then I'm going to do a round of going around and just hearing a little bit about what it would mean to you and yourself, your communities you're in, the institutions you work in, the field you work in. Like, what would the People's Response Act passing mean for you? So get ready for that. But some dots I just want to connect are, one, I think about in public health, we talk about how we need to de-emphasize individual behavior change. Like, if you're just focusing on whether someone's grabbing for a piece of fruit, instead of focusing on what foods are available in a community and are they affordable, are they, the sort of structural questions. It's not, you're given a set of choices given the systems and environments and structures you live in, and we should be focusing on transforming those instead of sort of blaming people. There's a victim blaming element to wagging your finger at someone for their individual choices. If they choose to smoke a cigarette, if they choose to grab a bag of potato chips instead of a piece of fruit, like all of this. And yet in public health, we exceptionalize criminalized behavior. So we can talk a good talk about someone's individual, we shouldn't focus on individual behavior change with smoking, eating, exercise, etc. But somehow if the behavior is criminalized, then it's that person's fault. So how do we bring that kind of analysis to the ways that we understand what is and who is criminalized as well? It's one dot to connect. I want to thank you, Karis, for bringing in the historical perspective, which has been so important to me in my practice and the way that I think about my work around state violence. I'm fourth generation Japanese American. My family was incarcerated in World War II simply for having Japanese ancestry. And the work I do today in trying to prevent and address state violence, for me, I think of as part of my intergenerational healing practice with my family, right? So this is not just something of the 40s that was in World War II, and this is a continuing legacy from the colonization of this land, from the kidnapping and enslavement of African people and Black people to the incarceration of Japanese Americans in World War II. There's this ongoing legacy, right, that we can understand in that context. And Courtney, I want to thank you for your note around the fact that people are getting to, like, we can learn and unlearn these sort of ways of being, and that people are getting to live. Like, I made me think about the Miriam Kaba quote around how white affluent communities are living in the abolitionist future we are fighting for Black and brown communities, right? Like, they have the resources, this exists. The environments we're advocating for exist right now. They're just pretty much sequestered to white affluent places. And then finally, I want to also just a dot that you made me think about, Courtney, with your remarks, was around Ruth Wilson Gilmore's quote around abolition being about presence, not absence. It's about life affirming institutions, which is, again, exactly what we're trying to do here with the People's Response Act. We're trying to build the life affirming institutions, bolster them for the ones that already exist, and really think about resourcing those. So again, I would love to hear from each of you about what it would mean to have the People's Response Act passed, to have these grant dollars made available to community organizations, local government and state government, to be able to build up our non-carceral, non-punitive safety infrastructure. And any one of you can go first.
I'm always so bad about these things. Love the panelists, love y'all in terms of the space. I mean, I always say this no matter what, and I think I need to upgrade it because we're in 2022 almost. So I always say I live in 2040. I probably should say 2050 because it's coming sooner than I think. But I think when it comes to anything that we as a community, as a people decide to do, I think it is a beacon to me of how much humans can move forward and actually reconcile with some of the things we deal with. But it's also a way for us to say, like, this is what we all socially agree to. That's going to be our norms and our practices so that we can build families, communities, and really just dismantle the ways in which we've kind of made things move. So all it is to say for me, I think as a public health practitioner and a scientist, I mean, there's always going to be innovation and things that we'll have to tackle as like humans, especially with nature and animals and things. But, you know, the more that we can have things in place that say like, hey, you know, we have communities who are able to have the resources to be able to build these like solutions that don't involve being so punitive. But we have folks who are formerly incarcerated who are building communities and trying to heal from the trauma of what's gone on historically. Or we have folks who are really just trying to, you know, help us decolonize our practices in science, where it's more a community-based practice versus, you know, certain people getting paper publications and that type of thing. These types of legislative practices and policies, public policy, just in general, allow us again to be the next step. And I think we have to keep doing that, and not necessarily doing it in a way where it's many steps. Like, I think small, as Audrey Marie Brown has said, is great, and small is really important. But to keep building on those small steps to actually make bigger leaps and like keep pushing against the things that, again, we sometimes are indoctrinated on. Because I really appreciate what the panelists and all of us have said, in that, you know, the more we invest in the solutions people already have, and the more that we say like we commit to this, the more it's more on us to have a sense of social responsibility, and really just build relationship with each other in an authentic way. Because at the end of the day, abolition is politic, and a lot of us in our backgrounds recognize that relationship building, the people that we build with, and the people that we know who have networks that we connect to, that's going to move us forward as a group of people at the end of the day. That's really going to make the difference. And that type of science fiction you can't replicate without actually taking the steps towards that. So I think that if people really want to be a part of the solution, it's really making a commitment of like what things in place, on the books and policies and practices can we recommit to and actually stake a claim for, and find the people that we can build with, so that when we get to 2050, which I think we will, I think it'll be, a different space, but we can tackle different types of challenges and be grateful for the solutions that we're working with. So I'll stop there.
Okay, oh no, go ahead.
Okay, yes, ma'am. So I would like to quote one of the other co-founders of the Anti-Police Terror Project. And the other co-founders are Cat Brooks, and I'm quoting Terha. He's always taught us that the best ways to be safe is to build relationship, right? Is to know who the people next to me are, right? To the neighbor across the street, who's the owner of the store on the corner, like that is the best way for us to remain safe. For me, the People's Act is confirming, right? It's that I may be able to experience the world that we're building toward, right? Just even if just a little bit. There was a time when I kept my personal nursing practice and my organizing life very, very separate. And I did that intentionally, right? And as the work furthers and we get closer, right, to this world that we're building, those things cannot be separate. I am not separate, right? Like my nursing life and work and my organizing life and work have to exist in the same place. And the kind of world that we're working towards is one where that is a given and not something that I would even, or anyone else would even have to grapple with. To show up in any space as my whole self, right? To do the work that I'm passionate about on multiple levels. We should all have the right to do that. And the passing of this act will just be so confirming. And just one more thing before this is done, but there's so many sectors that could be deprofessionalized, right? Like a university deciding that it costs X amount of dollars in education to then turn around to be employed by that same university is like, right? So there are lots of things like peer support folks, the kind of folks that we want to hire for mental health first, right? Certain healthcare practices can be deprofessionalized and given jobs, equitable jobs, to those who are impacted and to those who are interested and passionate about doing the work.
Okay, so I can't pass now. So so there are a lot of things that are going through my mind. This is such a hard question to answer. So I will start with a quote as well that, and it's one that I rely on a lot. It's one from Martin Luther King. Well, it's not really a quote, but basically it's the idea that the saving of our world from pending doom will come not through the complacent adjustment of the conforming majority, but through the creative maladjustment of a non-conforming minority. And I think that means that, we're all starting to say, well, no, we're not kind of going to take this anymore. We're really going to work together towards community-based solutions, especially those that address those that have been so disproportionately impacted. So when I think about the passage of the act, again, I think about what community safety means. It means that I am safe rather than being seen as a Black person who is seen as causing communities to be unsafe. It means that as a person given a diagnosis of schizophrenia, I am safe rather than the community being safe from me. Community safety means health, well-being, recovery, flourishing freely in community so that we are all safe together. I think of another quote from Martin Luther, from MLK, which is when I is replaced, when I in illness is replaced by we get to wellness. So really, it means that those of us who have been disproportionately impacted, historically so, will be building a community-based response that works for the community, not imposed on the community, but developed for and by that community.
Thank you so much. That was a great note to end this panel on. I want to just name how many other voices and leaders and movement heroes, sheroes that we brought into this space. I think it really speaks to one of the things I love most about this movement work, that it's so leaderful and comes from this place of abundance. We have an embarrassment of riches with knowledge and inspiration and ideas and commitment and integrity, and you all embody that. And I think a lot of the folks whose work and words we uplifted here today embody that as well. So that was kind of a accidental or unplanned, I should say, sweet thing that I just want to notice. So this feels like this could be a forever conversation. And as one of my, just to throw in one more quote here, as my movement comrade Isaac Ontivero said the other day in a meeting we were in together, that time is on our side, but the clock is not always our friend. So I'm going to wrap us in this portion of our session here today. I just want to say thank you, thank you, thank you so much, Asantawa, Courtney, Karis, for joining us here today, for the work that you do out in the world. And I don't mean that in a necessarily professional sense, but just you being you and you doing, getting into the good trouble that we need out in our communities. So thank you so much.